no communication from the chair, but the majority leader will proceed and table the notice paper. Minority Whip, on behalf of the majority leader, proceed.
Thank you, Honourable Speaker. With the permission from majority leader, we do to the latest paper as follows. Tuesday, 4th August 2026 at 9:30 a.m. We have several papers. We have a paper on the report of the Committee on Public Service Administration and Reformation on the County Public Service Board, annual report for the year 2025, sponsored by Honorable Edna Obogo Kimori, Chairperson. We have a report of the Committee on Health Services on Nyandarua County Health Facilities Improvement Fund, FIF, report and financial statement for the period ended 30th June 2025, sponsored by Honorable Paul Geshe Waboida, Chairperson. That report of the Committee on Legal Affairs, Labor and Intergovernmental Relations and Coordination on the report of the Office of County Attorney for the period 1st July 2024 to 30th June 2025 by Honorable
Mr. Speaker. What is it? Mr. Speaker, we have a stranger in the house. Who is the stranger? Honorable Mr. Speaker, he's hiding that at the far end of Honorable Deji, who is out of order. Honorable Gitao, Mr. Speaker. Order. He is not fully dressed now. Fully dressed now. Deji, you are out of order. Out of order. Don't interrupt the business of the house. Thank you. Proceed, Honorable Ibrahim.
Thank you, Honorable Speaker. Honorable Speaker, on motion on bills.
Point of order, Mr. Speaker. Mr. Speaker, this is the House of... Mr. Speaker, Honorable Gashoba is properly dressed. Order, Honorable Deji.
Clarification, Mr. Speaker.
What is it?
I think Honorable Senji is completely out of order, because when a member is dressed in a good shirt and a tie and a trouser, that member is properly dressed. As we speak, Mr. Speaker, the climates in this house are a bit hot, so members can remove their coat. They are okay with a sweat, tie and a shirt. So Honorable Deji is completely out of order and he's disrupting the business of this house.
Honorable Peter Deji, member for Urie, you are out of order. I direct that you stop interrupting the business of the house forthwith. Proceed, Honorable. Order. Proceed, Honorable Ibrahim.
Thank you. On motion on bills, we have a motion of point of order.
What is it, Honorable Kayeni?
Mr. Speaker, with the utmost respect to the House, this is a House of procedures. And if you have made a ruling that somebody who is not in a court, as required by the Speaker's rules, is properly dressed, then you set a precedent. And I want you to confirm that, so that when I come in this house without a court, then I know I'm properly dressed. Kindly confirm that. Thank you.
Honorable Kayeni, who is not in a court?
Honorable Speaker, this house has CCTVs. Honorable Gashoba, when Honorable Deji was talking, was not in a court. And Honorable Milka, in her own submission, said that somebody with dressed in a shirt is properly dressed. I don't have an argument. I just want you to confirm that if I come in this house without a coat, I am properly dressed as a precedence. I'm not disputing any ruling whatsoever.
Point of
If that's the
information,
case,
Honorable Speaker.
That's okay. Honorable Kayani, order. By the time I listened to all the views and observations of the members, Honorable Kayani and honorable members. By the time I was making my ruling, everybody was properly dressed. Therefore, that is how I based my argument, my ruling. Order. Mr. Speaker, Ibrahim. Proceed, Honorable Ibrahim.
On motion and bills, we have a motion on the report of Committee on Health Services on Engineer County Level 4 Hospital Annual Report and Financial Statements for the year ended 30th June 2025. Sponsored by Honorable Paul Geshe Wabaire. Honorable Speaker, today at 2:30 p.m., that is 4th August 2026, we'll have a paper report of the Committee on Health Services on the County Government of Nyandarua JM Hospital, half-year report and financial statements for the period ended 1st December 2025. Still by Honorable Paul Geshe Wabaira, Chairperson. We will still have a motion on the report of the Committee on Water, Sanitation, Environment, Tourism and National Resources and Climate Change on Nyandarua County Climate Change Fund Annual Report and Financial Statements for the financial year ended June 30th, 2025. By Honorable Isaac Bai Kamau, Chairperson. Honorable Speaker, tomorrow at 9:30 a.m., that is 5th August 2026, 9:30 a.m., we will still have a paper report of the Committee on Public Works, Roads, Transport, Housing and Energy on the Departmental Budget Implementation Report for the financial year 2025-2026, sponsored by Honorable Simon Bogo Bolo, Chairperson, Committee on Public Works, Road Transport, Housing and Energy. We will still have a report of the Committee on Trade, Industrialization, Cooperative Development and Partnership on the status of response on queries raised to the County Executive Committee member for Trade, Industrialization, Cooperatives, Development and Partnership during the Committee on General Oversight, sponsored by Honorable Samuel Limwe Kayani, Chairperson. Honorable Speaker, on motion and bills, we will have a motion on the report of the Committee on Education, Vocational Training, Culture, Gender and Social Protections on the County Government of Nyandarua Bursary Fund half-year report and financial statements for the period ending 31st December 2025, sponsored by Honorable Peter Gadhogo Kamau, Chairperson. Tomorrow at 2:30 p.m., that's 5th August 2026, we'll have a paper report of the Committee on Lands, Physical Planning, Housing and Urban Development on the County Government of Nyandarua SECOD Kenya Informal Settlements Improvement Projects, KISIP 2, quarterly report and financial statements for the period ended 1st December 2025 and March 1st, 2026, sponsored by Chairperson Honorable John Duogashino. We still have a report of the Committee on Education, Vocational Training, Culture and Gender and Social Protection on Oljorok and Kipipiri sub-counties, vocational training centers, annual reports and financial statements for the year ended 30th June 2025, sponsored by Honorable Gadhogo Kamau, Peter, the Chairperson. We'll still have a notice of motion on the report of the Committee on Education, Vocational Training, Culture, Gender and Social Protection on Jororok and Kipipiri sub-counties, vocational training centers, annual reports and financial statements for the year ended 30th June 2025, still by Honorable Peter Gadogo Kamau. Honorable Speaker, on statements, we will have a response to a statement sought by Honorable Joyfrey Waluiro Kamwana on the status of LAD at Engineer Stadium and the works on the prefield by Honorable Joseph Kuria Duo, Chairperson, Committee on Youth, Sports and Innovations. On a second response to a statement sought by Honorable Samuel Limui Kayani on the status of employment of ECD teachers and disbursement of captations to ECD centers, sponsored by Honorable Peter Gadogo Kamau. On motions and bills, we'll have a motion on report of the Committee on Public Service, Administration and Devolution on Nyandarua County Devolution Support Program, that is KDSP 2, half-year reports and financial statements for the period ended that 1st December 2025, sponsored by Honorable Ednant Wabogo Kingori, Chairperson. Honorable Speaker, this notice paper is prepared, published pursuant to Standing Orders 40 and 41. Is dated this 4th day of August 2026 by Mr. Mukiri Mushiri, Clerk of Nyandarua County Assembly. Thank you, Honorable Speaker. I do table.
The notice paper is duly tabled. Clerk, next order.
Order number 3, messages. Order number 4, petitions. Order number 5, papers. Mr. Speaker, sir, under this order, there are a number of papers to be tabled. The first being a paper by the Honorable Edinand Wambogo Kingori, the Chairperson, Committee on Public Service, Administration and Devolution.
Honorable Edinand Wambogo Kingori, Honorable Gashamba, on behalf of the Chair, proceed.
Thank you, Honorable Speaker. Honorable Speaker, I like to table report on public service, administration and devolution on the report for the year ended, that is December 2025. And before Mr. Speaker, I read the report. I want to congratulate the new elected member of Parliament, Samin Douglas Kamau Wawelu, as a new member for Parliament for Kalau. To the people of Kalau, I wish to take the opportunity also to congratulate you for the resolve to have a new member of Parliament. May God bless Honorable Kamau Wawelu as he deliver on the mandate that has been mandated by his people. Thank you, Mr. Speaker. Mr. Speaker, the Committee on Public Service and Devolution has a report for the year ended that 1st June, that 2025. The Committee on Public Service, Mr. Speaker, Administration, Devolution has been considering the County Public Service Board annual report for the year ended that 1st December 2025. The committee is yet to compile a conclusive report. In the light of the above, Mr. Speaker, the committee respectively seek an extension of 21 days to allow sufficient time for members to review, finalize, and adapt the report on the County Public Service Board annual report for the year ended that 1st June, December 2025. Accordingly, Mr. Speaker, I humbly request that this House grant the committee the additional time required to conclude its consideration of the report. Your indulgence and your support in this regard, Mr. Speaker, will be highly appreciated. On behalf of the Chair, I beg, Mr. Speaker, to table.
The preliminary report is duly tabled. The leave sought is well explained and deserving, and so I grant it as sought. Chairperson, ensure the report is ready within the time requested. Next order.
Under the same order, Mr. Speaker, there is a paper to be tabled by the Honorable Paul Ngeshi Wambaire, the Chairperson, Committee on Health Services.
Honorable Paul Geche Wabaire, Chairperson, Health Services Committee. Proceed.
Thank you, Mr. Speaker. The Committee on Health Services was duly mandated by this Honorable House to scrutinize and report on the Nyandarua County Facility Improvement Financing Annual Report and financial statements for the period ended 30th June 2025. Pursuant to this mandate, the report has been the subject of the committee's deliberations, during which members undertook a comprehensive review and analysis of its contents. Upon concluding its initial consideration, the committee identified a number of issues requiring clarification from the accounting officer responsible for the health facilities improvement financing. Consequently, the committee formally wrote to the accounting officer seeking responses to the issues identified during its deliberations. The requested responses have since been received and are currently before the committee for scrutiny and consideration. In view of the ongoing review process, the committee respectfully requests this Honorable House to grant an extension of 30 days to enable it to conclude its scrutiny and submit a comprehensive and conclusive report to the House. Thank you, Mr. Speaker, sir.
The preliminary report is duly tabled. The leave sought is well explained and deserving, and so I grant it as sought. Chairperson, ensure the report is ready within the time requested. Clerk, next order.
Under the same order, Mr. Speaker, there is a paper to be tabled by the Honorable Kasana Hussein Dongo, the Chairperson, Committee on Legal Affairs, Labour and Intergovernmental Relations and Coordination.
Honorable Hussein Dongo Kasana, Chairperson, Committee on Legal Affairs, Labour and Intergovernmental Relations, Coordination. Any member on behalf of the said chair? In the absence of any delegation, I refer the matter back to the House Business Committee for rescheduling. Clerk, next order.
Order number 6, notices of motion. Order number 7, statements. Order number 8, motions and bills. Mr. Speaker, sir, under this order, there is a motion to be moved by the Honorable Paul Ngeshi Wambaire, the Chairperson, Committee on Health Services.
Honorable Paul Geche Wabaire, Chairperson, Committee on Health Services. Proceed.
Mr. Speaker, this is a report on the Engineer County Hospital Annual Report and financial statements for the period ended 30th June 2025. There is a list of abbreviation. There is definition of terms. There is acknowledgement. I can lead this part. Mr. Speaker, the Committee on Health Services is one of the sectoral committee with a very critical role in the county. I appreciate honorable members for rigorously executing their mandate of representation and oversight. I also wish to thank your office and that of the clerk for facilitating the committee and offering the relevant technical expertise through the secretariat in pursuing its core mandate. I extend my appreciation to the members of the committee for their commitment and believe that we shall continue to expedite our mandate with diligence and goodwill for all our electorate. Finally, Mr. Speaker, sir, it is my pleasure and duty on behalf of the committee to present this report to the House for consideration and adoption. Mr. Speaker, the annual report and financial statements for Engineer County Hospital were duly tabled before the House by the Leader of the Majority Party, Honorable Elijah Mwangi Nyaga, and subsequently committed to the Committee on Health Services for detailed scrutiny and consideration. And of course, Mr. Speaker, this committee is established under Standing Order 200 of Nyandarua County Standing Orders. And the mandate is highlighted A to G. So further, the committee is stipulated. The committee subject areas stipulated in the first schedule for the standing order and borrowed from the fourth schedule of the Constitution of Kenya and the County Government Act 2012 includes all matters related to the county health services, including medical services and in particular county health facilities and pharmacies, ambulance services, promotion of primary health care, licensing, control of undertaking that sell food to the public, refuse removal for refuse dumps and solid waste disposal, cemetery, funeral parlors, and crematorial burial for animals. Mr. Speaker, the committee membership, Honorable Paul Gesha Wambaile, Chairperson, Honorable Jane Gathera Joroge, Vice Chairperson, Honorable Isaac Kungu Wanjiro, Member, Honorable Peter Denji Keriga, Member, Honorable James Mwangi Geshoke, Member, Honorable Joyfrey Waruiru Kamwana, Member, Honorable Maureen Wairimu Mugaki, Member, Honorable Peter Mwangi Maina, Member, Honorable Babu Juliana Mogure, Member. Also, we have Secretariat, Ms. Gladys Nyawera Karuiro, Committee Clerk, Mr. John Kahiga Kavue, Senior Legal Counsel, Mr. Benjamin Gatonga Munyaki, Sergeants at Arms. We have TOF. For the purpose of this exercise, the committee's terms of reference, as derived from its mandate and ratified by the committee in a meeting, were as follows: to review, analyze the annual report and financial statement of the Engineer County Hospital for the period ending 30th June 2025, identify areas that require further clarification with the Department of Health Services, hospital officials, and other relevant authorities or agencies. 2, to request for submission from key stakeholders on issues identified or related to the report. 3, to prepare and submit to the House a comprehensive report on the annual report and financial statement of Engineer County Hospital for the period ending 30th June 2025. Chapter 2, we have committee proceedings. Since the commitment of the Engineer County Hospital annual report and financial statement for the financial year ended 30th June 2025, the matter has constituted the main agenda of the committee meeting. These have facilitated in-depth scrutiny and internalization of the report and financial statements. During the process, the committee wrote to the hospital medical superintendent requesting information on the issues emanating from the annual report. This helped the committee obtain clarity on certain issues therein prior to the compilation of the final report for the House. We have legal underpinnings. Mr. Speaker, sir, the annual report and financial statement of the Engineer County Hospital for the year ended 30th June 2025 were submitted to the County Assembly in line with Section 166 of the Public Finance Management Act 2012. The committee's scrutinized annual report and financial statement for compliance with provision of section 166 of the PFM Act 2012 as enumerated above, and other provision including section 147, section 149, section 153, and it is detailed, but it is well highlighted in our report. So I now move to observations and findings. We may start with the overview. Engineer County Level 4 Hospital delivered a year of purposive consolidation service, expansion, and strengthened governance during financial year 2024-2025. Despite physical pressures and sector-wide policy transitions, the hospital improved clinical outcomes, exceeded revenue targets, expanded infrastructure, and reinforced accountability systems. Operations remained aligned with Kenya health sector priorities, including universal health coverage and non-communicable disease management. We have service delivery performance. This one is clinical activity. Mr. Speaker, the hospital maintained strong utilization levels as outlined. 27,255 outpatient visits, 2,044 inpatient admissions, 4,756 specialized clinics visits, 1,928 deliveries. Out of 1,928, 364 were cesarean sections, 239 surgical procedures, 170 bed capacity. Demand pattern shows sustained community trust and increased health-seeking behavior, particularly for chronic disease and maternal services. Maternal and neonatal health. This outcome reflects strengthened triage protocol adherence, multidisciplinary coordination, and theater preparedness. 0% maternal mortality. No death to the conceiving mother. Operationalization of a newborn NBU unit awaiting full commissioning. See, we have improved obstetric readiness and emergency response, specialty and diagnostic services. These expansions reduce referrals and enhance continuity of care. There is introduction of hematology services. There is progress toward in-house pathology services. There is strengthened laboratory turnaround times. There is routine morbidity and mortality reviews institutionalized. Financial performance and stewardship. Revenues performance, 53,789,934 million corrected. Target, they had targeted 46,311,336 shillings. Revenue exceeded target significantly. Cycle improvement included a strengthened claims documentation, cashless payment adoption, better alignment with the Social Health Authority, enhanced eligibility checks and pre-authorizations. 6, we have financial controls. Financial controls, we have improved budget absorption, timely quarterly financial reporting, no major audit findings, strengthened finance and audit committee oversight. However, liquidity constraints persist due to delayed third-party reimbursement at county level fiscal pressures. Pending bills, 20,601,394 shillings. This remains manageable, but requires reimbursement stabilization to protect supplier relationship. Governance and institutional strengthening. The hospital strengthened corporate governance through board induction and capacity refresh, quarterly board and committee meetings, development of annual budget and work plan, initiation of a 5-year strategic plan, compliance with Public Finance Management Act, Health Act, IPSAS reporting standards. A landmark institutional achievement was acquisition of the hospital land title deed after 32 years plus expansion by 1.5 acres, securing long-term growth capacity. Operational strength, quality and patient safety. A, routine morbidity and mortality audits. B, improved IPC compliance. C, enhanced documentation accuracy. D, neonatal mortality decline. E, reduced claim denials. Oxygen reliability. A, we have bulk oxygen arrangement commissioned. C, B, manifold system operational. C, improved reliability across wards and theatre. Environmental and waste management. A, 100 waste segregation compliance. ADAPILA reporting. B, functional incinerator 70 kg per hour. C, tree planting and sustainability initiatives. Human resource development, continuous medical education programs. CPD compliance achieved, mentorship and reduction program active, gender diversity compliance to that rule met, key challenges and risks. Despite progress, several structural risks remain: liquidity and cash flow, delayed SHA and insurer reimbursement, pending suppliers bill, physical constraint at county level, the human resource gaps, critical shortages in surgeons, anesthetists, consultants, nurses, radiology, and the pharmacy staff. Workload pressure increases, burnout risk, and supervision strain. Raising NCD and mental health burden. Top morbidity include hypertension, diabetes, mental disorder, respiratory infections. This shift demand to long-term outpatient chronic care models. Infrastructure and capacity constraints. We have a limited OPD space, pharmacy storage limitation, equipment breakdown risk, growing utility strain, electricity, oxygen, fuel, supply chain, vulnerabilities, dependence on CHEMSHA, risks of stocks out during procurement transition, policy shifts affecting commodity funding. We have external access constraints, deteriorated Jackman Hospital road. Only one ambulance serving Kinangop sub-county. These affect emergency responses and patients' experience. So, Mr. Speaker, there is strategic priority for financial year 2025-2026. The hospital forward focus includes full commissioning of the newborn unit, expansion of pathology and homopathology services, strengthening chronic disease management system, enhancing claims processing and liquidity management, digital transformation, EMR, integration and data strengthening, targeted recruitment and staff redistribution, infrastructure expansion aligned to land acquisition, utility cost optimization and oxygen contract efficiencies, community and stakeholder advocacy for road and access improvement, overall assessment, strength position, strong clinical performance, zero maternal mortality, revenue above target, strengthening governance system, infrastructure expansion underway, improved quality and safety culture, risk position, liquidity instability, HR shortages, growing chronic disease burden, infrastructure strain, supply chain fragility. Committee specific observation, findings and recommendation. The Committee on Health Services, upon perusal of the annual report and financial statement of the Engineer Level 4 Hospital for the year ended 30th June 2025, observe concern that required clarification from the medical superintendent, who is the accounting officer of this county entity and also double up as the secretary of the hospital board. The issues are discussed below. Number one, employee cost. The issue here, Mr. Speaker, is variance between employee cost and employee-related cash payments. The response was from the management is that most staff costs relate to permanent employees paid directly by the county government, while the hospital paid cash workers. Actual cash payment included settlement of prior year accruals. But the committee noted that the management adequately explained the variance between accrual-based employee costs and cash payment. A significant proportion of staff costs are borne directly by the county government and disclosed as in-kind support. So in future, what we recommend, Mr. Speaker, is that management should provide detailed annual reconciliation between employee costs recognized and actual cash payment, and enhance the closures relating to county government funded staff. By so doing, everything will be in a limelight. Mr. Speaker, the second issue was on medical service waivers. The issue here is clarification on accounting treatment of medical service waivers. Management explained that waivers were granted to vulnerable patients and they acknowledged that they are better treated as a reduction of revenue rather than losses. So the committee observed that the waivers were not properly authorized. In addition, they are not appropriately classified as losses in the financial statements. Committee recommends that management should review the accounting treatment of medical service waivers and ensure that the future financial statement classifies such an amount as losses. Even if it is classified as loss, I think that this was inspired a certain cost. Let's say 20,000 in a hospital. When you leave, how you treat that amount of 20,000? It should be a lot because graphs have been used, pharmaceutical costs have been used, around that the items have been used. So when the note is below research, to now reduce the result and that was what we did. The waiver is 20 million. One waiver, the financial institutions will be indicated to give it in relief. So that artificially we will go through the waiver because we will leave that up the entire revenue if we are not careful. As a entity. All the questions should be granted in accordance with the point of finance. And actually, Mr. Speaker, and also the members should know that whereas the CCS finance the way they are reporting, they should be including those documents there, so that it is part of annexures that we waived this supporting document. So it was how it was framed. It was to bring out the real meaning. The issue of receivables, Mr. Speaker, is another issue. This is the issue is increase in receivables and impairment policy. So management provided such use of receivable and indicated that no formal impairment policy currently exists. So here, the committee expressed concern of the absence of doubtful debt policy despite the increasing receivable balance. What we mean here, Mr. Speaker, in this dispensation, we should now have policy. Our institution should now grow, should have this policy because of stability. What we are saying is this management should within 90 days establish a receivable management and impairment policy and periodically assess the recoverability of outstanding balances. As simple as that. You know, Mr. Speaker, Mother Teresa of Calcutta tell us, though she died, it is the small things that matters. You have heard what is happening in engineer. It is as a result of our continuous engagement with them. This report, it deviates from the other report that we brought in this house. There is a 90% improvement. So when we emphasize on these small details, Mr. Speaker, it means we are headed to good times, to our infrastructures, to our facility. And in our case here is the engineer. You know, it is the second, but if taken care of, it can do better. So there was the issue of depreciation expenses. The issue here was increase in the depreciation expenses. And you know, management is attributing the increase primarily to depreciation of an ambulance acquired for the hospital. You know, the other time you had there was auctioneers. We fear if depreciation is increased this way, then all of a sudden you find so many vehicles, government vehicles will be auctioneered. So this is a loophole. So what are we saying? The committee it was supported by asset additions and application of the approved depreciation schedule. Management should maintain comprehensive asset register and provide detailed depreciation schedules in future reports. Management should maintain an updated fixed asset register and a depreciation schedule detailing all assets, additions, disposals, and the depreciation charges. Simple as that. Register. You know, in our other report, Mr. Speaker, we were saying we don't have even the log books. There was a report that was indicating some of these government, we don't have even the log book. And I don't want to revisit that because when I was contributor, I was even asking whether we need to confirm whether even the one that the vehicle that His Excellency drives, whether it has the log book. I was saying that. So they must maintain register. So the other issue is transfer to the county government. You know, there is a deduction to transfer to the county revenue fund. This is necessitated by FIF. So management explained that adoption of the facility improvement financing framework enabled the hospital to retain most of its revenue. The committee noted that implementation of the FIF framework in country reduced transfers to the county revenue fund. Now here we recommend something because facility improvement fund, we have passed it is a good thing, but it has got its own challenge. Only that we are going to come up with the report. But before then, what we are saying, we have three points. Management should ensure strict compliance with the facility improvement financing framework and maintain proper record demonstrating the utilization of retained revenue. Because, Mr. Speaker, when we have the fund, we have the money, we have the record, we have the document, we can have the paper trail, we can follow to the rata. And the only thing that can happen is maintaining that fund. We have money, and it is only that we can now be able to perform our duties. Future reports should also clearly disclose the impact of FIF implementation on hospital revenue management and service delivery. Number 3, management should ensure full compliance with FIF framework and provide detailed reports on utilization of retained revenue. The number 6, the issue is on budget surplus versus accounting deficit. Variance between budget surplus and accounting deficit. Management explained that the budget is reported on a cash basis while the financial statements are prepared on an accrual basis. So the committee noted that the variance was made due to accrual accounting adjustment and non-cash expenses such as depreciation. So management should provide a detailed reconciliation between budget performance results and the accrual-based financial performance in future reports. Such reconciliation should clearly identify the effects of depreciation, accrued income, accrued expenses, and other non-cash adjustment to enhance understanding of financial performance. Then there is capital. I am almost there, and my second Jane Gadera is already prepared, so I'm almost there. So capital expenditure utilization, there is low capital budget absorption rate. Management explained that delayed recovery of receivable affected cash availability and necessitated prioritization of recurrent expenditure. The committee observed that low capital expenditure absorption may have delayed implementation planned projects and equipment acquisition. So we recommend that management should strengthen the debt recovery mechanisms and improve project implementation planning to enhance development budget absorption. Also, project planning and budget execution should be enhanced to ensure timely acquisition of critical equipment and improve absorption of approved capital budgets. So, in conclusion, upon thorough examination of the Engineer County Hospital annual report and financial statement for the financial year ended 30th June 2025, the Committee on Health Services established that while the hospital continues to play a vital role in providing essential health care services to the residents of Nyandarua County, several administrative, financial, and operational shortcomings require urgent attention. The committee acknowledges the management efforts in maintaining service delivery amidst physical and infrastructural constraints, including the progress made to upgrading the hospital to a fully fledged level 4 facility and securing ownership of its land after more than 3 decades. This Mr. Speaker, 32 years without title deeds, they now have. This is a milestone. And this milestone reflects commendable commitment to institutional growth and long-term sustainability. However, the review also revealed persistent challenges such as inadequate documentation of waivers, expenditures, delayed reimbursement from the county treasury, and SHA, incomplete financial reconciliation, and insufficient automation and audit controls, the absence of board adoption minutes, non-valuation of hospitals' land, and gaps in revenue disaggregation further highlights weaknesses in financial governance and compliance with the Public Finance Management Act 2012 and its attendant regulations. The committee therefore emphasizes the need for the Department of Health Services and the hospital management to strengthen accountability mechanisms, enforce proper record keeping and reporting procedures, and ensure timely submission of budget and statement for legislative oversight. Addressing human resource gaps. Adoption innovative cost-saving measures will also be critical to improving service delivery and financial sustainability. In conclusion, the committee reaffirms its commitment to supporting the continuous improvement of Virginia County Hospitals governance and performance framework with the ultimate goal of ensuring sufficient, efficient, transparent, and accessible healthcare services for all residents of Nyandarua County. God bless Nyandarua. God bless Virginia. God bless this assembly. Thank you, Mr. Speaker. I now call the seconder, Honorable Jane Gadira.
Honorable Jane Gadira Joroge, proceed.
Thank you, Mr. Speaker. I second.
The motion is duly moved and seconded. I propose the question, which is that the House does adopt the report of the Committee on Health Services on the Engineer County Level 4 Hospital Annual Report and Financial Statements for the year ended 30th June 2025 as a report of the House and the recommendations therein as the resolutions of the House. I now put the question, which is that the House does adopt the report of the Committee on Health Services on the Engineer County Level 4 Hospital Annual Report and Financial Statements for the year ended 30th June 2025 as a report of the House and the recommendations therein as the resolutions of the House. May those of a similar opinion say aye.
Aye.
May those of a contrary opinion say nay. And the ayes have it. Order, Honorable Matimu. Thank you, honorable members, and thank you, Honorable Geche, for such a very good report. And I hereby, on behalf of the House, commend the Committee on Health Services for their up-to-date reports and very good oversight on behalf of the House. Next order.
Mr. Speaker, sir, we have exhausted the business as is appearing in the morning sittings order paper.
Honorable members, there being no other business to transact during today's sitting, I now adjourn the House to Tuesday, the 4th of August 2026 at 2:30 p.m.